Hello, future educators. Before I start on my reporting today, let me give you a short trivia. There are many cases of unplanned and teenage pregnancy across the world. A recent Philippine Statistic Authority, or PSA, showed an alarming increase of girls getting pregnant during their adolescent years. The data indicates that birth to mother ages 15 to 19 years old have increased every year since 2016. So the question is, how are we going to avoid teenage pregnancy or unplanned birth? There are many types of methods to prevent that issue, and this is what I will discuss today. So, a pleasant afternoon to each and everyone. Allow me to introduce myself. My name is Jana T. Alvarado, and I am from GO9 Apostle Philip, and of course, our subject for today is human reproduction. So, my topic for today is all about reproductive health contraception. So, what is contraception? Contraception is the act of preventing pregnancy. This can be a device, a medication, a procedure, or a behavior. Contraception allows a woman control of her reproductive health and affords the ability to be an active participant in her family planning. Certainly, there are various options for controlling fertility ranging from abstinence to contraceptives. So here are some common methods. So abstinence. Abstinence is a practice of refraining from sexual intercourse. This is the only 100% effective method for preventing pregnancy and the transmission of sexual transmitted infection, or what we call STI. When we say abstinence, no sexual intercourse happens. If two people don't have sex, sperm can't fertilize an egg and there's no possibility of pregnancy. It requires self-control and communication between partners. So next is, I wait, but sexual intercourse cannot be really avoided, especially among long-time partners, married couples, and even sa mga kabataan ngayon. Good thing we already have what we call contraceptive methods. So next is for barrier methods, we have condoms. Condoms provide physical barrier that prevents sperm from reaching the egg. It is 98% effective. They also help protect against STIs. So lahat naman siguro tayo alam kung ano ang itsura ng condom. It's a rubberized balloon na pinapasok sa ari ng lalaki kapag nakikipag-sexual intercourse, para yung sperm cell di makapasok sa cervix ng babae. So next, the diaphragm and cervical cup. These are dome-shaped devices that block sperm from entering the cervix, the entrance of the womb. They are used with spermicide. You only have to use a diaphragm or cup when you have sex, but you must leave it for at least 6 hours after the last time you had sex. You can leave it in for longer than this, but do not take out before. So, for hormonal methods, we have birth control pills. Oral contraceptives contains hormones that inhibit ovulation and thicken cervical mucus, making it difficult for sperm to reach the egg. So, ito yung iniinom na gamot to prevent pregnancy. At rini-regulate din ito ang regla ng mga babae. So next, the birth control patch. A hormonal patch worn skin that releases hormones to prevent pregnancy. The combination of the hormones, progesterone and estrogen, is the patch prevent ovulation. So, ovulation is the release of an egg from the ovaries during the monthly menstrual cycle. If an egg isn't released, a female can't get pregnant because there's nothing for sperm to fertilize. The hormones in the patch also thicken the mucus produced in the cervix, making it difficult for sperm to enter and reach any eggs. they have been released. The hormones can also sometimes affect the lining of the uterus, so that if the egg is fertilized, it will have a hard time attaching to the wall of the uterus. So next, the birth control injection. An injection of hormonal contraceptives given every few months. The birth control shots are sometimes called Depo-Provera. The Depo shot or DMPA contains the hormone progestin. Progestin stops you from getting pregnant by preventing ovulation. When there's no egg in the tube, pregnancy can't happen. It also works by making cervical mucus thicker. When the mucus on the cervix is thicker, the sperm can't get through. And when the sperm and the egg can't get together, pregnancy can't happen. So next is the intrauterine device or the IUD. A T-shaped device inserted to the uterus to prevent pregnancy. It releases copper to stop getting pregnant and protect against pregnancy for between 5 and 10 years. It's sometimes called a coil or copper coil. So there are hormonal and non-hormonal IUDs. Next is the emergency contraception. These are pills or devices used after unprotected sex to prevent pregnancy. They should be taken as soon as possible after intercourse. Emergency contraceptive pills work by delaying ovulation. So, as I said earlier, the ovulation release of an egg during the monthly cycle. If fertilization and implantation have already happened, ECPs will not interrupt the pregnancy. So, for natural methods, we have fertility awareness-based methods or FAM. Tracking menstrual cycles, body temperature, and cervical mucus to identify the fertile days and avoid intercourse during that time. So, ito yung ginagamitan ng calendar methods para malaman kung ilang days pwede kayo mag-sexual intercourse ng partner mo at anong days ang iiwasan nyo. Next, the withdrawal, also known as pull-out method, where the male withdraws before ejaculation. It is a traditional family planning method in which a man completely removes his penis from the vagina and away from the external genitalia of the female partner before he ejaculates. But take note, natural methods is not 100% safe from pregnancy and STIs infections. So for sterilization, we have tubal ligation. Tubal ligation is surgical sealing or blocking of the fallopian tubes in women. During tubal ligation, the fallopian tubes are cut, tied, or blocked to permanently prevent pregnancy. Tubal ligation prevents an egg from traveling from the ovaries through the fallopian tubes and blocks sperm from traveling up the fallopian tubes to the egg. The procedure doesn't affect your menstrual cycle. So for men or boys, we have vasectomy. Vasectomy or the male sterilization. It is a surgical procedure to cut or seal the tube that carries man's sperm to permanently prevent pregnancy. Vasectomy is a form of male birth control that cuts the supply of sperm to your semen. It's done by cutting and sealing the tube that carries sperm. Vasectomy has a low risk of problems and can usually be performed in an outpatient setting under local. It is a permanent birth control. Then we also have contraceptive patches and rings. These are hormonal methods that release hormones through patches and vaginal rings. The patch, pill, and ring are birth control methods made with hormones estrogen and progestin. They are similar to hormones found in the body and they prevent you from getting pregnant in two ways. So first, they stop the eggs from leaving the ovaries. Then, second, they make cervical mucus thicker, so it's hard for the sperm to reach the egg. Next is we have spermicides. It is a chemical substances that kill or immobilize sperm. They are often used in conjunction with barrier methods. Next, the copper IUD. This is the non-hormonal IUD that releases copper ions to prevent fertilization. It's sometimes used as emergency contraception. So, my report ends here. I hope you learned something today. Always remember that the choice of contraception methods depends on individual preference, health consideration, and the effectiveness of the method. It is important to consult with the healthcare providers to discuss the best option for our specific needs and circumstances. Additionally, using condoms or barrier methods can provide protection against both pregnancy and STIs when used correctly. So, thank you for listening. I hope you have a great day today. Thank you.